In the world's most polluted city, today we come from the India Habitat Centre, which is one of the most greenest urban spaces in the capital. But if you thought you could come here, take a break and get a breath of fresh air, you're probably wrong, because you're surrounded not just by lots and lots of traffic right here on Lodi Road and the neighbouring areas, but there's also Lodi Gardens just a stone's throw away from here. And contrary to what you may think, it is one of the places which has been tested and found to have amongst the highest levels of air pollution. Perhaps there's a touch of irony in there, because that's the place where the political powers, perhaps the most important people in the country that sit in Parliament, go there to get fit. So, in fact, I spoke to the Environment Minister, Mr. Prakash Javadekar, about how serious the problem of air pollution is, not just in the city, but across the country. We know now that it is the 5th largest killer in the country. Let's listen in to what he said.
You introduce Delhi as the most worst polluted city as if it is a place of pride. No.
It is. It's
no,
actually a matter of shame.
No. I don't want to dispute. The facts are basically different. But one thing is sure, that we are at least 3 to 4 fold of what we should be. And I have a very ambitious and doable program which will partner not only state governments and governments, but people, media, and all agencies to put together, the industry, and everybody has to be partner.
So that was Prakash Javadekar speaking to NDTV on our Clean Air My Right campaign, where we basically look at how the pollution in the city is now a public health emergency. To talk a little bit more about that, we've got with us Archana and her daughter Vani. Vani's been asthmatic since the age of 3, and she comes as a part of the vulnerable groups who are most affected by the killer air that we're breathing. We've also got with us Sunita Narayan from the Centre of Science and Environment, Dr. Randeep Guleria, who's head of the Pulmonary Department in All India Institute of Medical Sciences, and perhaps to try and put up, give us a sense of what the Delhi government is in fact planning to do about the situation in the city. We're joined by Saurabh Bhardwaj, who's the Aam Aadmi Party MLA and former Transport Minister. But just before we come to the policy measures and what needs to be done, Vani, you know, a lot of people now in the city are having respiratory issues. You've had asthma since the age of 3. You come as a part of the vulnerable groups for whom breathing is actually far worse than it is for me. Tell us a little bit about how difficult it gets for you to breathe in this city.
Well, being asthmatic becomes a big roadblock in your day-to-day life, because you can't think of leaving the house in a public vehicle, or even traveling in a car with the windows open. You need a car with an air-conditioned car basically. And you know, traveling from your home to your workplace becomes very difficult in that kind of situations.
So basically, in a way, public transportation is completely out for you.
Completely out, yeah, sort of. Yeah, the buses and autos and rickshaws, they're out. Metros are still manageable.
Yeah, and as CSC's study had shown that metro, the pollution levels are much lower than they are outside. But Vani, I know that you study in Chennai and you come back and forth to Delhi. Is there a difference that you feel in your own health when you're traveling back and forth?
Yeah, there I don't require that much medication and all that. But whenever I come here, so that is the, you know, at that time, you know, just when I land in Delhi, that is the time that I need my medication once again.
Typically when you get like an asthmatic attack and, you know, it gets worse with the pollution in the city, what does it typically look like?
How difficult I start
is it?
Getting this, you know, restlessness and then breathing difficulty. You know, it starts, you start feeling like there's choking in your windpipe. The air gets very heavy when you try to breathe. And it sort of feels like you're working on, you know, breathing. And also when you speak, you know, speaking becomes very difficult.
Ma'am, would you like to tell us a little bit about how difficult it is to actually deal with, your daughter having such a severe case of asthma? Or
Yeah, actually, when she was small, it was very difficult. But as children grow, you know, they are able to manage their asthma. But still, you know, even they have to take puffs or medication, it is also not good thing. But we have to give. And there's chemical as such, chemicals you are taking through medication or through you are inhaling. With the pollutants level are very high now, especially in Delhi with so much traffic on the road.
If I could just get Dr. Guleria. We know, of course, Saurabh, your daughter as well is having respiratory issues. So I think this would definitely be something that is really affecting all of us in a sense, isn't it, Doctor? I mean, it is equally hard for each one of us who's out, whether we're out on the roads, whether we're inside our cars, or whether we're sitting inside our houses.
What air pollution can do, you need to look at it in sort of, I would say, two broad categories. One is how does it affect the vulnerable group and those who are otherwise healthy but are living in an area of constant high levels of air pollution. So if you look at the vulnerable group, and that is asthmatics, patients who have chronic bronchitis, patients with heart disease, when they inhale a large amount of or large levels of air pollution, the respiratory passage gets swollen. It causes a narrowing inflammation of that passage, and that's, like Vani said, there's breathing difficulty. You have to really work to breathe. There's a feeling of tightness in the chest, and this happens to a lot of asthmatics, people who have COPD or bronchitis, and it also at times leads to worsening of your breathlessness, and if you have an underlying heart disease, it can worsen your heart disease. But if you look at the healthy people, and there are a lot of people who come to Delhi from outside and they start wheezing at night. Some of them have cough, they have no family history of asthma, they are non-smokers, but suddenly they start having breathing difficulty.
Okay, Doctor, one of the problems, when we talk about air pollution amongst Delhi has been that a lot of people don't recognize the gravity of the problem because, a little bit of a cough or a little bit of sniffly nose, they feel is not fatal in many ways. What would you say to somebody like that?
If you look at data, almost 40% of low respiratory tract infections globally are linked to high levels of air pollution.
In fact, Central Pollution, a government study in 2012 had said 1 in 3 kids see reduced lung function. So what does that mean for them growing up?
As these children grow, they will have a poorer lung function, which will predispose them to breathlessness in later life, and therefore it's like a person who has been smoking since early childhood and going on to develop bronchitis. So it's like passive smoking, if I may put it in that way.
With passive smoking, I want to take that across to Sunita. Your study that you had done just last month, in fact, found that this winter was so bad for Delhi that it was like smoking between 20 and 30 cigarettes every single day for every single person. I mean, for a little child, that's absolutely abominable figures.
Kashish, if you just take a comparison, you just see what's happening this week in Paris, where the pollution levels are much lower, and yet it has been declared a smog emergency in Paris. Yeah. And the government in France has said that all public transport is going to be free, because they have to make sure that the number of cars reduce. And they've also said that the advisory will go out to children, asthmatics, more vulnerable groups, not to come out of their homes. Now, if you look at Delhi over this winter, then frankly, every day almost in Delhi should have been a pollution emergency. And that clearly says that we may not be feeling it today, though Dr. Guleria has very clearly shown us that even if we don't die instantaneously, it is harming our body enormously.
And we're cutting off several years of our lives, no?
And cutting off years of our lives.
And now even cardiologists or studies from outside suggest that constant exposure to high level of air pollution should be considered a risk factor for heart disease as much as we look at high cholesterol, high blood pressure and other risk factors. So it's a preventable risk factor for heart disease.
But yet we're looking at it as the 5th largest killer in India. Sort of, that's a whole lot to throw at you. We know your government's been in power just for about a month, but give us one reason why we should feel that the Delhi government with 67 seats is serious about this problem.
There are many reasons for that. Our own chief minister suffers from asthma, and so the head of the government also feels and also has experience that pollution affects you a lot. And other than that, before we were into the government, we had that Delhi dialogues where there was a lot of concern about pollution, and when we formed the government, in that Delhi Dialogue Commission we have formed task forces, and I think 2 task forces are seriously working on this pollution, the one on the environment and another on the transport thing. And we as a government seriously feel that we have to improve public transport in Delhi. So we are thinking of improving last mile connectivity, because I think a lot of people want to travel by metro, but they don't have a last mile connectivity from metro to their houses. So we are trying our level best, and this is something I can promise you. as a representative of the government that we are very serious about upgrading our public transport in Delhi.
But Saurav, and I'll come back to you later. If I could just bring that back to Sunita. Sunita, public transportation, improving public transportation is only one part of the problem.
But it's a very big part of the solution. And we have to understand that in a city like Delhi, the biggest game changer that will come is when we actually make sure that we can move people and not vehicles. Because if you look at it, we brought in CNG 10 years ago. We did manage to clean up Delhi's air. We could see the stars, as I constantly say. We could breathe better. Dr. Guleria's data will show that at that period, the levels of emergency room admission for respiratory diseases went down. Asthmatics felt better.